Became a doctor because I think that there are people or experiences that you have in your life that kind of shape what you become. And for me, it was my grandmother. She was a nurse midwife and a poorly controlled diabetic, and she died in her late 50s. And it was really because she didn't have access to good quality primary care. And so that's probably true for a lot of people in West Virginia. And I was good at math and science, and I thought if I can make a difference in my community, I should try. And I think that I always wanted to do primary care. That was clear. I tried pediatrics, and children cried all day, and that wasn't really a good fit for me. So I decided to specialize in the care of adults. Internal medicine is a little different than family medicine because we only do adults, but we spend 3 years studying everything from common medical problems like you would see in the office, all the way to hospitalized, complex patients, even to intensive care. Studies show that women spend more time talking to their patients. They're more interested in what's called patient-centric communication. So they don't want to just treat your illness. They want to know about your emotional well-being. They want to know what your lifestyle's like and how all of those things might impact your illness. So doing all of that has kind of been shown to keep people out of the ER a little more and has led to less hospitalization. So those are all good things, I think, for your pocketbook. But that same sort of care that they bring to their patients, they also bring to the workplace. So they're more interested in staff and their colleagues having work and lifestyle balance. So I think back to some of my older colleagues 25, 30 years ago, they would work here 24, 48, 72 hours straight and not even think about it. But how is that healthy for anybody? And so I think women have sort of challenged the industry to change in that regard. If someone younger approached me and said, I'm thinking about medicine, usually it's because they love math and science. And I think I would tell them first, choose a field that you love, because if you love what you're doing, it's never work. Medicine is hard work and it takes some dedication, but it's so rewarding and so exciting. I've been in this business now for 25, 30 years, and I have lifelong relationships with my patients, with their children, with their grandchildren, with my colleagues. Not one day is the same. And I feel like if you really want to make a difference in the community that you live in, this is kind of the way to do it. When I first started my career, I had an older professor who said to me one day on rounds, I was the only woman on the team, he pointed at me and he said, women are going to be the ruination of this medical field. And we had a really interesting conversation about that because he felt like women would be more likely to work part-time or to leave early in the career to have children, and that maybe there wouldn't be enough doctors to treat the population. And what we've seen is that as times have progressed, both men and women, I think, want lifestyle change, right? Work-life balance is important to keeping folks mentally healthy so that they can in turn provide care to their patients. I think women are big advocates for policies around gender equity and inclusion. They tend to go into primary care. They tend to advocate for the underprivileged communities. And so I think that they've really changed the industry in the focus of what medicine should look like.